Okay.
So we're going to, I hope I know how to work this, launch right into it. I'll go into a little bit later on tonight about where we're going, but for right now I want to talk to you a little bit about the year that we've just had. One thing that is new that I'll mention right off the beginning, though, is we have a new vision and a new mission statement. So thanks to Accenture, they have a wonderful pro bono team that helped with us as a charity. And together as a board, the board came up with the vision to support the journey to a healthy mind, and the new mission statement is to empower Canadians to take charge of their mental health by helping them identify issues early, navigating the resources to achieve healthy outcomes faster. So it's all about action now. It's all about getting help for the people that need help the fastest way possible and getting them the best resources possible. I think most of you in the room are aware of our events that we put on. Our Lunch and Learns are probably the most popular event. We certainly do them more regularly than anything else. Our Bell Let's Talk, we'll be doing another advocacy campaign, awareness campaign in advance of Bell Let's Talk. And that is a month-long initiative where we get campaign managers and regional organizers all across the country to help kickstart the conversation about mental health 1 month in advance of Bell Let's Talk. So it's not necessarily the fundraising drive that Bell Let's Talk does on Bell Let's Talk Day, but it's an awareness to create communities across Canada of people that can carry on that conversation all year long. Difficult Conversations at Work. Sarah Lindsay is right there. She partnered with us on this big one. This was done at Trios College, and it was to make sure that people in the workplace have the, I guess, not necessarily they have the skills, but they have the know-how how to start those conversations within the workplace about mental health and addictions, and how to engage in them, and when and where to have those conversations that might be best appropriate for the situation. Roots and Shoots is a yoga program that we offer to young children in the greater Peterborough area, and it is all about getting kids to be comfortable in their own bodies. We mostly run it in disadvantaged neighborhoods and schools and community centers, and one correctional facility or guidance facility for young children. Taking charge of your own mental health. This is really a neat program where we haven't run one this past year, but it's a pillar of us and exactly describes where we're going, because it's all about a full day of making sure that panels, it's all educational, but the panels consist of people with lived with experience and the professional sector. And so we have that dialogue about what it's like to have those conversations between your healthcare provider and the person with the mental illness or addiction right in front of the audience. So it really stimulates some great conversations and can direct people to the resources that they need right away. And ACT is our youth event. It's a full-day program. This year we ran an 8-week, 8-session course, so we broke out the full-day program into 8 weeks, 8 sessions, and we trained really on youth advocacy and got the kids to, they're young adults, how to empower them so that they can start community groups in their own area where they live, or a group in their school, or join, or how to become real advocates, how to help a friend in need with mental illness, and how to spot the signs and symptoms in themselves. ACT highlights, 100% of our attendees found that the program was an engaging one, and 89% plan on recommending the program to others, and 78% already did. So just some really high-level things. This bottom quote here was the real winner for me, because we had a young person there that was able to identify the need to ask for help herself and was able to get that. And sometimes I'll say, if I can just reach one person in a room, I've made a difference that day. And so we were really grateful to that program to be able to do that. And that's just one example. And so we were identifying and finding and helping and working with children who were able to then to be advocates in their own mental health. Highlights from the workplace mental health program. And so people loved it. We did some team building exercises. They found that really empowering because that was with their colleagues, and it sort of broke out of the shell, that conversation, so that these people were having conversations about mental health and addictions amongst their colleagues, which for us means that they're going to be carrying on that, and that wall has been broken within their place of work. This was a really interesting opportunity for us because it was a webinar and live conference that was done and beamed through to 13 locations simultaneously across Canada. So it wasn't just in one location, which made it kind of tricky to run and keep people engaged for a full day. But thanks, Sarah, because Sarah did it. We brought in a great guy who does some YouTube videos and really kicked it up a little notch, and then did homework exercises in work groups where we had pre-surveyed the population that we were going to be serving that day, so that we used case studies that they had actually given to us as things that they encounter. So it was very applicable to their daily lives within their work environment. This was to the teachers and administrative staff at Trios College, not to the students. And then we did our Scotiabank Marathon. We're going to be doing that again this year. So I know that Jumana, my communications and marketing person, is somewhere in the room, and she will kill me if I don't plug that this one's coming up again. I think it's at the end of October. It's really exciting for us because we get to raise a little bit of money, but we also get to raise quite a bit of awareness for our organizations and be part of a bigger team of all sorts of people who are running to make a difference on that day. Our Healthy Minds Canada Bell Let's Talk campaign, as you can see, it's the #1 driver of new followers and new likes and new friends on social media platforms. So it really stimulates our online community to get involved and to stay involved and to have a conversation online, so it's not just one way us putting information out. It's people that were engaged. And thanks to our communications manager at the time, Chelsea Riccio, who's left here, she really spends a large part of the actual Bell Let's Talk day working with the people that have been with us all month to have actual conversations back on Twitter so that people who are new to that subject that day can find pools where they can come and ask for help rather than just witness the flow of information on that day. And we just had a big online audit report telling us how to do better for next year in terms of general online stuff, and engagement online on social media is one of the #1 things. And so this day is just a reminder to us how to put that experience of that one day into practice, for the whole year. Increase engagement online. And then our Lunch and Learns, here's one example. This was done at Bellwood, which is one of the facilities within the Edgewood Health Network. And we did addictions in the workplace, and it was a great lunch. We had people with lived experience and professionals who had a dialogue about really some of the broader topics of what do you do with an addiction or a potential addiction in the workplace. How do you have that conversation? How do you make accommodations for it in the workplace? How do you bring these people back to work? How to work with their treatment center, if that was a case, how to work with the rest of their care providers, and then also working with the family. So how do employers and managers reach out past the person from the place of employment and reach out to the family, because that's going to be a real indicator of relapse or to a safe transition back to the workplace if the family is supportive. These are just examples of our program sponsors. I shouldn't say just, because we're excited to have them all on board. And these are people who are either donating financially and or gifts in kind, which is really a huge thing for us, because it means that we can start to figure out whether or not the programs that we're testing out really work. This little one with no words on it is the ThereforeYou app that we're really pleased and proud to be a part of. Christophe is with us in the audience, and we're excited for that. Antidote is something that I'll get into a little bit more in the looking forward one, but it is a company that's out of the US that we've partnered with that can match people to clinical trials in their neighborhood. So we're getting into a bit of smart technologies that can really fast track people to the help they need faster, but the right kinds of help, because the person is being assessed in a really user-friendly manner. They barely know they're being assessed, and then guided to those resources there. And so we're excited with that. Pfizer is a big contributor to a research initiative that we have. And these are the people who we collaborate with in the community. Usually it's when we're invited off to speak, and sometimes it's we're doing a presentation or a workshop. So you can see it's not just what we do here, but it's where we are out in the community as well. I wish I could say a lot of these were representative of across Canada. We're mostly here in Toronto, even though we are a national organization. But we do have Calgary, and when we did a thing with TELUS, that was out in Vancouver. And so we have this year finally done some boots on the ground type stuff in the rest of Canada. Third-party fundraisers has been a big initiative of ours this year. We're still sort of in the feeling it out phase and making sure that they work. Cars for Cures is probably our newest relationship, where we're excited with that right now. People can donate an old car, and they get a tax receipt, and then we get a check from Cars for Cures for the amount that the car was valued at, or what they got for the scrap metal. And so we just get to sit back and watch the money come in. Ideally, that's the way it works. It's been a little more complicated than that, but we're excited for that. And so a lot of these are events too. I think one of them, Shift Your Thinking and Rim to Rim, have been projects that are really one person, just I want to run and raise some money, can I make a donation to you? And we're really proud to have them think of us as their charity of choice when they do something like that, and they get to make a big difference. And then Toronto 2.0 is a huge initiative where they've got people who are really power fitness people, and we're excited to be working with them, but and Epic Health is going to be hopefully a viral kind of challenge where you challenge someone to a health challenge of your interest, and it's sort of almost like the ice bucket challenge is in the developer's concept, that you challenge people to do this ice bucket thing, but people are challenging each other to do a marathon or to climb Mount Everest or something epic, and who can get to that dare and watch them. And there's online watching of how they're measuring up towards their goals and when their target date is. It looks really exciting. Wellington Financial are a couple of the guys from there behind it. And so I think their website was just recently built, and so we're looking to launch that pretty soon. But we've been building it with them in the meantime. Bloggers, we couldn't exist as an organization really without our bloggers. They are they provide daily content for us online, and they consistently rank amongst the #1 drivers of traffic to the website, and give us lived experience every day going out. So we have a rotating team of 10 bloggers right now. They blog once every 2 weeks, 5 every weekday. And then they'll get rotated out in 4 to 6 months, and a new team comes on board. So it's a constant refresh. It's a win-win-win. We elevate their profile online so that they can increase their audience of people who get to hear from their lived experience, strength, and hope of mental illness and addictions. We get content, and people get to hear the message, right? So then we sell our books, and we've got a big table over there. When something's wrong, these are always a little bit worrisome. They're hugely popular, but we've got to figure out how to move these from handbooks to an online platform. And so that'll be a little bit of a cost thing, and we're going to be working with some of the writers to reformat them in a way that these are a little bit more user-friendly, but they're still widely popular. Our teachers one and the families one, we just had a huge sale on during the month of September, back to school sale. Right now, the workplace ones are on sale at 50% off in honor of Workplace Illness Awareness Week. We ran our video again. I'm not going to play it this year because I played it last year, but it's a 15-second silent video that we get free ad space in Captivate elevators in Toronto. So if you're ever in an elevator in that first week, maybe it's the last week of August, and you're watching the TV up there, you'll see our ad from year to year. Our Supportive Minds, this is an online tool for parents looking for help if they think their child has a mental illness or if a behavioral issue, if something's wrong. We're looking to make this a little bit more, it's not mobile friendly. So it was built a few years ago. It's got great content on it. So we're looking to make it mobile friendly. I know we're behind in doing that. Everyone else has gotten their this is a different website than our actual home website. And also to build in two-way communication. So there's chat room capability. Right now it's one-way communication. So some significant upgrades there, and I'm looking to build a parent advisory council to kickstart that. This is the ThereforeYou app that I was talking about that we are partnered with. So what this is allows for you to have, it sort of feeds you types of questions to ask and engage with your child to bring them out a little bit more if you're not sure that something's wrong, they're not communicating properly, and to sort of ease your way into a nice conversation about anything with regards to your child. Christophe, again, is in the room, so if you have any questions about this app, I'll let him talk to you about it later. But we're excited. The more stuff on phones, we think the better. It's how people are searching for help nowadays, and any type of app. as long as it's, we've gone through it and we love the content in it. And so they're little quotes and sayings, and they're motivational, and they're supposed to spark discussion. Again, our Pfizer Awards, 2 awards of $25,000 we expect to award this year. The deadline for cutoffs was at the beginning of September, and the researchers are reviewing the submissions right now. We'll be announcing the winner of those awards at our silver dinner. This is a nice little graph that shows all of our research since 1998. So we've done $10 million worth of research, and this is the provincial breakdown. So you can see that even though in programs we're not necessarily across Canada, but in research funding, we're good. And these are some of our recent research winners. Chris Bowie is actually taking he was a 2013 winner. He's taking the information that he's gained from his study there, and is now kickstarting a subsequent study that we'll be working with him on. And so I've just gone over some of the preliminary documents that I think are still rather confidential, but we're excited to be a partner with him in this so that we'll move forward as long as we go together. And Norbert Schmidt as well says some pretty good updates. So please take a look and visit our website to see more information about that. One of my favorite nights of the year is our silver dinner. Last year we had the best silver dinner in the history of Healthy Minds Canada, I judged that by how much money we raised. So that was really good, and also how much media we got. So we had Billy Baldwin that year, who, thank you to his brother Alex, who was top of mind through SNL and Donald Trump, we were able to leverage a lot of the hoopla about the Baldwin brothers, and he got a lot of media hits. So we got a lot of recognition that evening and the day preceding it and that evening. And he was joined by his wife, who is she's a musician from Wilson Phillips, and she's also the daughter of one of the mamas and the papas. And then this year's silver dinner, we're super excited this year to have Alastair Campbell. He is from the UK. He's a former press secretary to former Prime Minister Tony Blair. He's got mental health issues, so psychosis and alcohol abuse and depression. His brother, I believe, committed suicide with schizophrenia. And he is also the ambassador for, I think, 4 mental health charities in the UK. So he's quite busy and quite an open advocate leading the cause for mental illness and awareness over there. And then we're also really pleased to have Seamus OReilly, now Minister Seamus OReilly, who will be our MC. Fingers crossed. We got him while he was still member of Parliament, and then he got bumped to Cabinet, and so we're playing at Cabinet Secretariat scheduling right now. But he's as of today, he's still on record as saying, I'm going to be there. And our annual report is available as of today by the front page of our website. So it is online only. You won't find printed copies here. We have little summaries that you can pick up here, but we don't pay for printing. I'd like to say it's to save the trees, but really it's because we're cheap. And Ali Spinner is our audit, and she's chatting, sidebarring with Michael and not listening to me. But Ali's coming up right now, and Ali's going to tell you a little bit about my favorite issue, money. So.
Thank you so much, Katie. Thank you to everybody for coming today. It means a lot to us. Are there others? Okay, sorry, that's an old picture of me. Okay, so the financials are up here behind me. Of course, they're on our website as part of the meeting documents. So again, we like to think of ourselves as the I don't want to say the little organization that could, but we do a lot with the little that we have. We are always amazed at the programming that we're able to put on for Canadians with respect to education and awareness surrounding mental health. And of course, fundraising these days is, I don't want to say that it's a struggle, but in some respects it can be, but we're always looking at ways as streamlining our activities and making sure that we're being as fiscally responsible as we can be. That's very important to us. So of course, as Katie mentioned, our silver dinner is coming up. We're riding high on the wave of last year's success, and we're looking forward to it. Alastair Campbell, it's Campbell, right? So I just want to make sure I didn't say it wrong. We'll be there this year. We're very excited to hear his story, and we're hoping that it drives a significant amount of donation revenue, again, at the event, so that it allows us to keep putting on the wonderful programming that we do. So that was my little piece. I'll give it back to Katie. Thank you.
This little slide here is in the mini annual report handout that's here. So if you do want to have a look closer, because I know I do appreciate that these numbers are really small and we're not trying to hide it from you or mask it. It's in the document that's printed. It's also on our website. And then one of my favorite parts of the evening, Perry, where's Perry? Perry is our volunteer of the year this year. So this is going to be a little bit tricky. Vicky, I'm wondering if you can come up here for a second. Vicky is just going to help me because I have no idea how else to have someone hold the microphone underneath my face. Or Allie can. That's all you're going to do because I just want to hand him the word.
It's a big job, but I got this.
Okay, thank you.
Okay,
And
so
then I
just
think
hold
there's
this.
someone who's got a camera because I just want to do a quick photo op. There. Want to do a quick photo op? Where are you? And this is Perry Jamu. Has been one of the most remarkable volunteers for us. You can move that now for just 1 second.
I got it on tape.
No. Is it straight? Yeah. Thank you. If you need more, we'll do one after. And I was about to give this to you.
Okay.
And Perry, I just wanted to thank you. Perry has been, he's been a volunteer, like not paid, not an intern, not doing this for any credit, and has come into our office really for a number of reasons, to help do research on upcoming lunch and learns, to organize a full lunch and learn from top to bottom. He was the main reason why we actually got a Movember lunch and learn done for men's mental health this year, which we were so thrilled with. We did a partnership with a little bit of prostate cancer, but actually the organization Movember, right? And has been helping with book orders. And when my communications manager left in June, he helped bridge that gap in between then and me bringing on board Jumana as our new communications and marketing person. So Perry, again, thank you, and I'm forever in your debt. Yeah. And now we have a guest speaker. So yet again, I get to leave the stage. And I'm really excited about this. This is Jonathan Andrews. Jonathan actually came to me via a woman who is a little bit of a regular donor to us, but also someone who is very engaged in providing me feedback with some of our lived experience online content. And she just randomly said it one day, look, I was at this event and I heard this guy speak. You have to get in touch with him. I got to set up a meeting. And I said, all right, I'll do it. And as soon as I'm halfway through the conversation, Jonathan, you can come up. I was like about 5 minutes in, 4 minutes in, and I said, I think we've got an opportunity for you here. So I'm going to let you take it away. The floor is yours.
Okay, great, thank you. First of all, I want to thank Katie and her entire team for the work that they do here. I know that they're making a big difference to not only advocate for, but raise awareness for people in Canada with mental illness and addiction. So can we give it up one more time for Katie and her team? And I also want to thank you for the opportunity to be in this platform and share my story, and hopefully, like you said, reach one person today. A negative view of self. A sense of hopelessness for the future, feeling isolated or alone, drastic changes in mood and behavior, self-harm, substance abuse, and frequently speaking about death. These are only a few of the suicide warning signs and symptoms. And this was my reality from 2011 to 2013. It was at 16 years old when I remember making poor decision after poor decision. I'm hanging out with the wrong guys. I'm skipping all my classes. And I give up the one thing in my life that gives me real meaning. I quit competing for Canada in trampoline across the country. I start to feel sorry for myself. I develop this disempowering self-talk, saying all the cliche things to myself. You're not good enough. You're not smart enough. You're not attractive enough. And then escalates to the point where I'm saying to myself, I don't even want to be here. I'm drowning in this pool of my own self-loathing. And finally, I get this great idea. Why don't I add drugs to the mix? With everything that was going on. And then adding drugs into the mix. What do you think that got me? The perfect recipe for depression and anxiety. It was later in 2011 that I was diagnosed with clinical depression. And I spent the next 2 years of my life shrouded by this dark, heavy, relentless cloud of negativity. And I know that I'm far from alone. I know there's people in this room that have felt the way that I felt. And when you feel that way, what's the worst thing that you can do? You try to get through it alone. I almost didn't survive that one. But fortunately, my parents stepped in and they helped me turn my life around. They helped me get the therapy that I needed, the medication that I needed. But that didn't last too long. My real saving grace, and my mom's here, and she can tell you the story, but was when they forced me, and I mean they forced me, every single Saturday morning for 2 years, from when I was 18 years old to when I was 20 years old, to participate in their business meetings. They brought me to the meeting every Saturday morning with their partners, and for the first 6 months, it was the most uncomfortable experience of my life. Every time I walked in that room, my palms and my back were sweaty, my face was hot, I was nervous, my throat was dry, my words would be heavy. But the 6 months that I spent in that room with those people filled me up. They poured into me. They filled me with dreams and positivity and visions for my future. They gave me the outlet that I needed to be able to express the way that I was feeling. They had me reading the right books. How many of you have ever heard of John Maxwell, Les Brown, Jim Rohn? It was at 18 years old when these people helped me learn what Jim Rohn said, and I know that it's something that Healthy Minds Canada and the people in this room can relate to and can align with. He said, direction over destination. Jim Rohn said, you can't change the destination of your life overnight, but you can change the direction. I didn't even know it, but I was changing the direction of my life. I'm now 19, and I don't need my medication anymore. I'm waking up excited. I'm building my first business. And it took 3 years, and it was a long process, but I, along with a ton of support, because I couldn't have done it alone, had overcome my depression. And although the direction of my life has changed many times since I was 19, my current direction is why I'm here. I always thought that my story was unique. But when I started to share it, teachers and parents and students would say things to me like, you need to share that story. Did you know that 1 in 5 youth are going to experience their own version of what you went through? I had no idea. But when I looked into it, I found out that suicide is the #1 health-related cause of death in youth, accounting for 1 in 4 deaths between the ages of 15 and 24. And it blew me away. That, coupled with, in December of 2016, I was visiting Guelph University. My girlfriend Victoria is also in the audience. She was a residence assistant at the time. And I was visiting Guelph right around their exam crunch season in December. And I got there, and Victoria said to me, I didn't want to text you, but one of the students in our residence committed suicide last week. And I later found out that 3 more students killed themselves that year. And 3 more students weren't going to be going back home to their family. In December of last year, I made it a personal mission of mine to be able to do something about it, to reach out to as many people as possible, especially students, so that they know that they never need to go through what they're going through alone ever again. That it's okay to not be okay. That there's organizations out there that are fighting for them. That it's in community that we find strength. That there's people like the people in this room that are there to help. That's why I'm here. And that's why I know that Healthy Minds Canada and all the work that Katie and her team doing are going to continue to support, especially like when I needed it, to support Canadians in their journey to a mental health, to a healthier mind. I know that as much as there's so much work that needs to be done, Canada is in good hands under their leadership. Thank you for the opportunity, Katie, and I hope to be able to meet. Thank you. I hope to be able to meet as many of you as possible after the event. Thanks, Katie.
Thank you so much. That was really powerful, Jonathan. Thank you so much for sharing that story. I didn't really think about the segue or transition then into Q&A, but I am open to taking some questions about the year in review, or I can go through and we can go on to the future programming, and then you can hit me with anything at the end. Does anyone have a preference? No? So I might just skip this. It doesn't mean I'm not going to take questions. It just means that I'm just going to move into the next part of the program. And I'll go through this relatively quickly. I am going to be in the room, obviously, until about 7 tonight, which I hope you will too. So you can ask me any questions if your question didn't get answered at the end of this, or if you want some further answers. We have our full strategic 3-year plan is on our website, where you look under annual report. It's right there. So this goes into more detail. But this is just skimming the surface of what Accenture did with us. And they really went through the full market scan of the mental health sector as a sector in Canada, and what Healthy Minds Canada's current assessment was, and where we thought we could go together. This was very comprehensive. This worked not just with staff, but really brought the board involved, so that this is the board's visioning exercise with a little bit of staff on how to execute it, right? So this is a broad visioning and a lot of Accenture saying, here's what's really needed. Here's the white space in Canada, which for us, it really meant that thanks to places like, well, thanks to us, Healthy Minds Canada, and other organizations, and Bell Let's Talk, really, in 2009 and 2010 with their first Bell Let's Talk Day, changed the landscape of mental health awareness in Canada. And so a lot of what we were doing, what we are doing, mental health awareness, isn't really solving any, it's not a solution anymore, right? There's a lot of people are aware that that a problem exists. What we really need to focus on now is getting people the help they need faster. People are now navigating a system which they find confusing, full of wait times, full of dead ends, and full of bureaucracy. So how do we, well, provide the resources on our website and guide people to the areas that they are customized to fit them? So I don't want to jump too fast forward, but these are a list of our strategic goals. I'm not going to read through them. Again, they're on our website under the main plan, and they're also on our website under the About Us with our, as I mentioned earlier, our new vision, mission, and mandate. So we are really here to be the main backbone of this journey. awareness and education, which is really early identification, journey navigation, and ongoing recovery support programs. These are the 3 pillars of Healthy Minds Canada today. Now, in the awareness and education, the early identification, that still encompasses our Lunch and Learns, our Bell Let's Talk, all the programs that I mentioned before. What it also is going to include is a tool that, thanks to Feeling Better Now and the team at Mansante who are here in the house, woohoo, we have renegotiated our relationship with them so that what we'll be doing very soon, and we've done part of this recently, is changing the flow on our website. So the main thing is people come to our website and they think they need help for themselves or for someone else. They can fill out an assessment. It will give them a customized toolkit. It's all DSM-5. This is non-diagnostic, but it guides them into the area where they can best find the resources suitable to them. Gives them the customized toolkit that's curated by the great people at Feeling Better Now, and also enhances those resources with our Healthy Minds Canada customized resources that they can then go off and use themselves. So they're really being the navigator and the driver of their own mental health care plan. It also feeds a report to their doctor so that they can then have that conversation with the healthcare provider that they work with and or team, if there's a team. So that this does, like Jonathan was saying, this doesn't happen alone. You need a team around you. And whether that's through organizations and resources that we pull together, including peer support or awareness raising events or additional community supports or an actual medical licensed care provider, this is all going to be done through there. And then ongoing supports, and this will be a little bit of more, sort of some of the stuff we're working on now, and some of it is kind of to be redesigns of our website so that it's not so menu, I'm going into a little bit of the weeds, but not so menu driven anymore in terms of where you go for help, but a lot more of the user directing themselves to where they're going. If anyone's ever been on the Kids Help Phone website, all it does on the main screen is say, how are you today, or how can we help? And the young person or whatever age the user is can fill that in, I'm feeling lost, or whatever generic language they use. And there's coded words, so a little bit, not quite artificial intelligence, but a little bit of smart programming in the back end that will then populate the next page with all the resources that are customized to that search. So it makes for a better user journey. Here's where we're seeing some of the Feeling Better Now. So again, to meet our mandate, which is in that fine print on the big slide that I showed you before, but it's on our website, we're working with Mansante. And we find that this is the best tool out there. Trust me, I've looked at a number of them, and I've also looked at ones in the States too. This is a made in Canada solution, and by far the best, and they work with a lot of companies, and we've been very fortunate to have a good relationship with them, and now to have a special, unique relationship so that we're able to offer this tool and this journey for your own healthcare to our community. And we're not a membership organization, so this is really driven through by coming to our website. As you can see, the stressed, anxious, depressed assessment, view your action plan, self-care, and you can view all this without creating a profile, or you can choose to create a profile and then monitor your progress as you go through. So this website here will be, once you've sort of decided you're going to do the assessment, this part of it is a little bit more embedded within the tool, but I put it there to not have to flip through so many slides. And then you've got your start assessment with you can see up here if you're coming back again, and you've got your resources, supports, mental health literacy, contact us, and these are some of the tools and how you'll search for them. So web, smartphone, self-care monitoring, health essentials, care map for depression, and that's just one example, but everything in the DSM-5 is there. And this one I'm really excited about. Chris Hobson is in the house, a little over there, and Stephanie Friel are two members of the team, and Christophe is on the team as well. Has been helping us with this app, and this is for peer support. And so what we've been finding through a lot of research is that people-powered health can and does save public healthcare systems huge amounts of money. The UK has done studies that it can save up to $14 billion in their healthcare system alone through people-powered connections. Similar studies out of the US. There are really no comparable studies in Canada, but alcoholics exist everywhere and addicts exist everywhere. And so this tool is originally going to be designed and piloted in the alcohol community, and then move to the wider addictions, and then eventually mental illness to cover peer support within the mental illness community. And it really, within addictions especially, and also within peer support, you can see here that the Mental Health Commission of Canada backs this up in finding peer support as an extremely helpful way to get people the help they need. People relate to people who have shared that similar journey. That's a key ingredient in getting people staying in recovery, whether it's keeping on their medications, if medications have been prescribed, maintaining their behavioral therapy or their lifestyle changes if that's what's needed, staying sober, staying absent if that's what's there. And so we're facilitating this app in the initial stages. We'll facilitate that sponsor-sponsee relationship. It's like a dating app, but to connect to a sponsor. So if you want to be a sponsor, it's going to hook you into a sponsee. And if you are a sponsee, it's going to find you a sponsor. So you can build a mentor, a coach type relationship, and create communities of support networks, and then offer a lot of resources on there. Like even things as simple as where do you have your first meeting with your sponsor? What do you say? What do you talk about? What kind of workflow? What are my goals? How do you articulate your goals to your sponsor? And this is what our original, very basic designing looks like right now. So I've actually got the incorrect screenshot up there, but right there you fill out a couple of quick things like just your postal code, so we can generally figure out your gender, a little couple of quick data points, but you're not yet creating a profile. And then you go, I want to be a sponsor, or I'm looking to be a sponsee, and then it pulls up all your matches, and it's blurred out in a probably not so drastic a way here, but all it shows is that look at the potential behind here. Now it gets you to create your profile. So we hook people in, they create their profile, gives them a little avatar thing. We've created some profiles here. Here are your top matches, and you can connect with either one of them, or you can click to see more. So we are hoping to be working with a team called Pivot to design and develop the actual app. And here's our roadmap and milestone. So we're excited for this. This is a huge undertaking. So I've already started on the funding proposal steps. I've got a pitch deck and I'm working on that, but I'm very excited for this to go forward. But we've really got a great team behind us. And so right now it's people powered on the development team, and the goal is to make it a people powered solution. Antidote, which is what I mentioned at the beginning, is a tool where you can, it's similar to the peer support app, but instead of finding someone to be your sponsor or sponsee, it's finding clinical trials in your neighborhood. So that what we want is to raise people's awareness of treatment options available to them, especially for people with perhaps treatment-resistant depression, or people who are finding they're outgrowing their medication, or that the medication has stopped working. This provides for options. You can see what's available out there that you might want to try, and tools to how to communicate with your care team, like your doctor, your care providers, your peer support workers, coaches, whoever you're working with, to make sure that's the right solution to you. So some trials require a doctor's note and some don't, and so we're going to give you, the user, the tools in order to have that and be armed with that. And like I said, these are really ambitious goals. I'm really just scratching the surface here. We're going to be working over the next couple of weeks to develop a big fundraising and marketing plan and get the message of our new goals out of here. And we're excited for it. I'm excited. I'm probably not showing my passion as much, but watch me win the rooms. If you want to get into a one-on-one with me, I'll become super animated because I really am excited about all these. And then this is the final slide. It's not the final, but we need your money to do this, so you better give us money. And the number one way you can do that is by coming to the silver dinner and showing up and paying up, and that's good. And maybe even asking a company or two that you know to come and be a sponsor. We like them. And then this is where you find us. And again, I promised I would be around for Q&A, so I'm here right now. You can ask me anything you want, and I'll also be around. And we've got staff around too, and board members who you can ask. Any questions? Don't be shy. Yep, we've got a question in the back. Do you want a mic? Oh, wait, we're going to run a mic over to you so it gets picked up on the audio feed.
I know a lot of parents of children with complex needs are really upset because a lot of these programs will not take their kids because their kids do not fit in an easy profile. They're not just depressed. They're depressed and destructive. They're in schools and they go to some places where they can't make and they do not get the help they need. So those parents are lost. The kids are lost. They're in school. They're lost. They're getting like tied to chairs and to because there's a lack of services. And I think that parents really don't know what to do. Kids are stuck. Kids are getting blamed for behavior that's not their fault. So I think there's a problem is getting the psychiatrists to accept kids as they are and get the service to fit the kid, and the schools accept that those kids belong there, and politicians to give the money, because you cannot do all this by raising charity. This is the government got to do.
I'll take that point. That's one of the reasons why we developed the Supportive Minds parent tool, and one of the reasons why we have the When Something's Wrong Ideas for Families handbook, is that families are often looking for coping strategies. So a behavioral issue with a child may not be a mental illness at all. It might be a behavioral issue. And different parents have different parenting styles, and different teachers to that same child would have a different manner of dealing with the child. And so what we want to be able to do is provide a forum for parents and teachers, whether separately or within the same forum. Right now, our Supportive Minds is parents really only, where they can go back and forth and pick out coping strategies that work for their child and share those that they find most appropriate, and or add new ones to the tool that work for them. So they're not just sort of solutions that are within the framework of a bureaucracy or within CAMH or a treatment center somewhere or a psychiatrist or whatever. We want these to be real, appropriate, and applicable for everyday families that are actually realistic, something that you would use in the home. So we want a mix of the professional advice mixed in with the lived experience and practical solutions that can actually work within the home dynamics or within the classroom. And I think that those are some of the best things. And one of the other things too, though, is that you certainly want that child, if there is a need for medical intervention, to have that care. And this is one of the things where we're going to be working behind the scenes here, is to curate that navigational tool so that you don't end up in a dead end where all you're being told is a wait list, right? Or the time it's going to take in order to be blocked off from finding the help you need. We want options available, and if they are going to be waitlisted for a service, because that's the reality in Canada, there just aren't enough psychiatrists to meet the demand, then we'll have other tools that are suggested to them to either bide the time, which is I hate that expression, but it's almost like mind the gap. So there's a program in between coming out of treatment and living in the community with an addiction, and it's bridging the gap. And it's people who will work with you until you've figured out how you're settled, and to help you get the family supports you need. Because sometimes people go into this bubble in treatment and then they're thrown back into a family that has the same family dynamics, and the addiction just festers again and there's relapse. So it's that kind of thing. What do you do? So what are the peer support networks that are available? Again, it's the peer support concept, I think, can really be applicable here, and it's empowering the community so that we can all help each other, not with sympathy, but with empathy, right? Like, we all have understanding. And so who's best to provide that understanding? Well, if I've been down that path myself, I might be the best one to provide that kind of support for you in the meantime, until you're getting the proper care as properly directed for you and your child. Because mental illness isn't just the individual, right? It's a family disease, a family illness, and same with addiction. And so it's how do you complement that care so that you can best sustain recovery once started. Any other questions? Yeah. We're going to get the mic to you.
Is the clinical trial app up and running now?
Yes.
Okay.
It's under our,
Simple.
we have it right now. It's a little bit buried. So part of the marketing plan that we go on will start to promote that and raise awareness that that exists. So it's under research and then clinical trials if you go to our menu tab. See how antiquated that is? I have to tell you how to navigate our website. That's not user friendly. And that's exactly what I mean by us fixing this, because it's not a good website. We find that it's hard to navigate if you don't know it's there.
And then I was just wondering where those trials coming from. Is it a database?
Yeah, that's a
that
great
feeds it
question.
in, or?
Yeah, Antidote, I think I mentioned that it was an American company. So it's based, well, it's actually, that's a lie. It's based out of the UK, but their main work is in the United States. So they pull the information, they pull all the clinical trials from a website called clinicaltrial.gov. So it's American. The good thing for us is that because we're in Canada, most, if not all, of the pharmaceutical trials that get published, they cross-pollinate. So if you go on there and you put in Toronto, for example, you're getting tons of hits with University Health Network, CAMH, all sorts of ones that get populated on clinicaltrials.gov. It's a US site. What we're going to be doing in the very near future, and it doesn't take a funding ask for us to start the ball rolling on this, is to work with the Canadian government and to work with some of the, I've had some interns who've gone through every psychiatrist at every teaching hospital and university to create a master list for me, is to reach out to each and every one of them and say, look, any trials coming up, we want that. And so we're gonna populate that. Now that's a really antiquated way of doing that. It's not just sucking the information in. There is, again, the Government of Canada resource that does list them all, but it is behind layers and layers and layers. It's not user-friendly at all. And so this is the problem that we're facing, especially for Canadians, any Canadian looking for clinical trials where they are, is every time you want to find a clinical trial, you have to fill out another profile, and it's just complicated. So we want to pull that information so it's in a searchable database, but then it's automated. It goes regularly with updates. So we're not constantly reinventing the wheel and reaching out to these people all the time. That's where it gets a little bit more tricky. So we can, for no cost, we can start the relationships and make people aware within the research and the public communities that this is what we're doing. And then in the longer term, it's about raising money to update and work with Antidote to complement their site with Canadian research in the broader spectrum. So it's probably a 2-year journey to get to where we want to go, but I would say it's a 6-month journey to start the ball rolling in that, and we should have a good update. And by this year, next time, when we're doing our next AGM, we should have a really good tool that is really a made in Canada solution. Yeah. Any other questions? Okay, so that's a wrap. I'm always happy with no hard questions. Again, like us and follow us on all the social media. I'm going to call Jumana up here for a second because I've been so busy talking about other stuff. And Jumana's new to our organization. She's our brand new communications and marketing manager, and she's going to plug a couple of upcoming events, and then you're dismissed and can eat. Woohoo!
Hello, everyone. Thank you so much for the introduction, Katie. I've just been here for about 2 months now with the organization and been thrown into a whirlwind. So I'm really excited to be here and grateful to meet all of you. So hopefully I will be seeing you all again very soon at the Scotiabank Toronto Waterfront Marathon, October 22nd. I'm sure Katie did mention it during her presentation, but registration is still open, but will not be open for very many more days. So get on our website, register, get your entire team involved, and we'll all be there cheering you on. And it's on October 22nd, so we're really excited to have it coming up soon. And of course, our gala, our silver dinner, is the 12th annual silver dinner at the Ritz-Carlton on November 13th. And Katie, of course, mentioned it, but it is so important to really spread the message and get your table, reserve your table, and it will be a beautiful evening. And we hope to see you all there. Thank you so much.